While most folks are familiar with what a midwife, a nurse, or an obstetrician do, you may not be as familiar with what a birth doula does. A birth doula is a professional who provides compassionate, emotional, informational, and physical support. During your pregnancy, our doulas are available to answer questions over email or phone. We encourage clients to call or email us regularly with updates and questions. This is a great way to get to know your whole team. Early in your third trimester, one of the birth doulas will reach out to you to set up a private virtual prenatal consultation. Among other things, we will ask you about your preferences and how we can best support you. We'll also use this time to go over logistics, what to look for as early labor signs, and how to best communicate with us during late pregnancy and early labor. We often get asked what is our philosophy or approach. We do not have an agenda for your birth. Some of our clients would birth in the ocean with dolphins if they could, and some of our clients would gladly teleport their babies out of their bodies if we had that technology. We're here for all of it and all of the things that more likely land in between. We meet you where you are in your journey, and that means we cater our support to your specific needs and your situation. We do work as a team practice with an on-call schedule, much like your midwife or OB practice. This means that you do not hand select which doula will be at your birth. While we each have different personalities and backgrounds, we practice in a similar way and are confident that you will have a similar experience no matter which doula you get. We use a centralized, secure database for your private information so that no matter which doula picks up the phone when you are in labor, we can remind ourselves that your favorite scent is, insert scent, maybe eucalyptus, or if you hate to have your feet massaged, our work as your birth doula blends in seamlessly with the rest of your support team. We work hard to enhance rather than replace any other support you may have. We advise you or your primary support person over the phone during the early parts of labor until you are ready for us to join you in person. Once we meet you either at home or a birthing center or the hospital, we continue to provide emotional, physical, and informational support. For example, we may model things for your support person, such as validating words or comforting touch. We also may provide a non-anxious presence and normalize what may feel not very normal to you. We're here to help provide context, so if needed, you can adjust your expectations and figure out what you want from your support team.
You may also be wondering how we advocate for you during your birth. While we are not your advocate in the legal sense, we advocate for you by facilitating communication with your medical team that will help keep you informed. We may also help create a space for you to have a moment alone. For example, we may notice a change in your body language, that you're feeling unsettled about something your provider has proposed. And we may speak to the room. Shailene, how are you feeling about that? Would it be helpful if you have a minute alone to process things? And then we may use that time to help you take a minute to check in with yourself and think through the questions that you may want to ask your provider to get the information that you feel you need to be comfortable with the plan moving forward. This is just one example of what our advocacy may look like in the birth room and how we use this to help you feel informed and empowered to make your decisions. We remain with you, guiding you and supporting you no matter how your birth unfolds, including spontaneous or medically induced labors, planned and unplanned cesarean births, and for however long it takes. This means that if you have a particularly long birth, we may send a backup doula to ensure that you have a continued fresh support with no additional cost to you. After your baby is born, we stay with you to help you in the immediate postpartum recovery to make sure that you are stable, settled, that you eat something, initiate skin to skin where possible, and talk through what comes next. As you transfer from your birthplace to your home, we continue to stay connected with you over text and phone, answering questions and offering pro tips. The doula who supported you at your birth will set up a time for a virtual postpartum check-in where we discuss your recovery and can debrief together about your birth. Working as part of your broader team means that we also help make sure you have a smooth transition to our postpartum support and connect with our postpartum doulas, infant feeding support, peer support circles, and movement series. We want you to feel the full support of your DC Birth Doulas community and know that no matter what, we've got you.